Today, I am delighted to be joined by Morgan Adams. She is a sleep coach, and we're going to be talking all about sleep coaching and how that can be helpful to your patients and your clients, and also Morgan's personal experiences with insomnia. I always think it's really interesting to hear a sleep specialist's personal experiences as well, because it really helps us to connect with our patients and clients too. So if you are new to this channel, I'm Dr. Nishi Bhopal. I am a physician specializing in integrative psychiatry and sleep medicine. And this channel is for the physician, therapist, and other health practitioners who want to uplevel your knowledge about sleep. So if that sounds like you, go ahead and subscribe to the channel. And you can also grab my free sleep mini course if you want to go a little bit deeper. It's all about free sleep medicine pearls you can use with your patients in your practice today. You can get that at intrabalance.com/doctors, and I'll put that in the video description below as well. All right, Morgan, thank you so much for joining me today. Maybe could you share with us just a little bit about your background and how you got into sleep coaching?
Sure. Well, I'm fairly new to sleep coaching, I think 3 years in. And I got interested in this because during the early days of the pandemic, I started to have trouble sleeping. And the backstory was I had had pretty severe insomnia about 15 years before that. And I got really concerned during this early part of the pandemic, March 2020. I was like, I do not want to have full-blown insomnia again. I need to nip this in the bud. So I started getting on Google, learning about sleep. I got my sleep in better shape pretty quickly, got myself an Oura ring, did all the things and was fine. In that process, I started to just organically share on Facebook things that I was doing to fix my sleep. And what I found out was that a lot of people in my circle were struggling with their sleep at that same time. And I was in a phase of my life where I was actually really questioning what I wanted to do career-wise, because I think that the pandemic did that to a lot of people. And I had previously, a few years before the pandemic, had a breast cancer incidence. And that really changed the trajectory of my outlook on the career things for me. And I just knew really deep down inside that I wanted to help women with their health, but I really didn't know how that would play out. And then once I got fascinated with sleep, it just hit me like a ton of bricks. I'll never forget the day that I told my husband, we were exactly where we were in the neighborhood, taking our dogs for a walk. I said, I think I need to be a sleep coach for women. And he was like, wow, you nailed it. That's perfect for you. You've got this passion for sleep. You want to help women with their health. And then I thought, well, okay, I want to do this. Well, how do I do it? So then I had to really do a lot of researching, and I got a certification in health coaching, and then did a couple of other sleep specific courses, because there's not, like, in my experience, there's not like one particular curriculum that gives you everything you need to be successful as a sleep coach. So it was sort of like piecemealing things together. And that's really kind of how I got into it. And I just love it. So I mainly see women, but a few men, but it's in fact, fantastic thing that I'm so excited about.
Yeah, thank you for sharing that. And I think it's wonderful that you decided on becoming a sleep coach for women, because, I speak a lot about the lack of sleep specialists there are globally, and of course here in the US. I think the most recent statistic I've seen is there's only 7,500 sleep doctors in the
Yeah.
US, which is a ratio of 43,000 patients to every one sleep doctor, right? So,
Mm.
for those clinicians who are listening, if you have patients who are struggling with sleep, you don't have to just think about sending them to a sleep lab or a sleep doctor. Of course, if they have a medical issue, like obstructive sleep apnea, yes, you need to do that. But there are sleep coaches that exist, like Morgan, who are available to support your patients with CBTI, with mindfulness for insomnia, which we're going to be talking about as well. That's part of her approach. So Morgan, could you share a bit more about what exactly is sleep coaching? Because even when I did my sleep medicine training, I'd never heard of a sleep coach. I'd never heard of a sleep coach actually until a couple of years ago through social media. It's
Yeah.
not something that I had learned about. So what is sleep coaching?
Yeah. I think it's a relatively new profession. And when I'm meeting people out in public and they're just like, what do you do? And I say sleep coach, they're like, what? And I'm like, it's sort of like a personal trainer for sleep. but it goes so much deeper than that. And so when I took my first coaching course, that we talked a lot about what is our role, and the definition that this person had, I'm going to just read it out loud: practitioner who understands sleep, recovery, circadian biology, all through the lens of behavioral coaching. I think that really encapsulates what we do. And, different sleep coaches have different niches. There's some that are more like into the recovery aspect, helping athletes. There are people who are more like into helping people in midlife, which is me. And so everyone kind of has their niche, and it's just really beautiful because I think there's a sleep coach for everybody, every kind of situation. So that's kind of what I see sleep coaching as overall.
Yeah, it's really helpful. And yeah, so yesterday inside of our clinical sleep kit program, which Morgan is a part of our community in that program, we were talking about supporting patients with sleep issues, and so much of it is behavioral. And of course, there are the medical aspects of it, but a lot of it is behavioral. And, as physicians or therapists, sometimes we don't have time to go into those aspects with patients. So that's where sleep coaches can be super helpful. So at what point, Morgan, should a doctor or a clinician consider referring their patients to a sleep coach?
Yeah, I would say if you have given your patient the sleep hygiene tips and those aren't working, that is a great opportunity to get a little bit deeper and have that patient get referred to a sleep coach. Or if it's the kind of patient who perhaps for some reason has been on sleep meds for a long time, and they're like, "Doc, I want to stop the sleep meds." I think working with a sleep coach is another great scenario where a sleep coach can help that patient, because the way that I work with folks who are coming off of sleeping pills is I have the doctor either create a taper schedule or sign off on one that I've suggested, because I don't want to work out of my scope. That's like the medical professionals, the prescribers' job to dictate that process. But it can be very challenging for a lot of patients to get off of these pills, and to have somebody who is there by their side, day in and day out, helping them out, giving them, lots of tools and techniques to build their sleep confidence. That's what I think a physician who's so busy can't really offer as much. And so a sleep coach can really help step in and provide that extra level of support.
So I'm curious, if someone referred a patient to, for sleep coaching, or a client to you for sleep coaching, what could they expect, just in terms of, how long is the sleep coaching process typically for a patient or client? And, what does the referral process look like? Could you share a bit more about that?
Yeah. So the way that my individual one-on-one packages work is the client gets a package of 8 sessions. So I have kind of toyed around with having 6 sessions, 8 sessions. I've gone back and forth, and I feel like 8 sessions is the best, because I feel like I'm getting clients who have fairly complex issues often. And we often will meet weekly, but sometimes as they're getting better over time, we will meet like every other week. So when you look at the totality of the engagement, it's usually about 3 months or so, because some people will skip a few weeks if they're doing really well and they don't want to use all of their sessions at once. And in terms of referral, on my website, I have something called a sleep clarity call, which is basically a 20-minute free consultation. So if anyone feels like they have a patient, they're like, okay, they could probably benefit from a sleep coach, they could send that patient my link to the call, and that patient can get a 20-minute consultation. And during that consultation, I really want to see if there's a rapport, because I think it's really important because it's a pretty intimate working relationship. And I feel like it's definitely important to have a connection, a rapport from the beginning. And another thing that I do is I do a screening for sleep disorders. There is an online screening called sleephealthscreen.com. And it's a very short questionnaire that I send to the client. And it basically gives you an inkling if they have one of the major sleep disorders. So sleep apnea, narcolepsy, circadian rhythm disorder. And if their assessment comes back where I feel like, this is a little out of my scope. This person probably has sleep apnea for sure, or something that I don't actually personally help with, I will just refer them to or help them get a referral to a sleep doctor, because I don't want to engage with somebody and then realize later, oh gosh, they have something completely different than what I thought. So it's a fairly, careful vetting process, because I think that's important on both ends.
Yeah, absolutely. And I think that's really helpful just to put it into context for people as well. So again, for the physician or the therapist, sleep coaching is not a replacement for the work that you're doing with your patients. It's really a helpful adjunct. So, so as Morgan was saying, tapering off medications, tapering off sleeping pills, it's a process, right? And the behavioral coaching around that is so important to your patient success. And so that's where someone like Morgan can be helpful. Maybe could we talk a little bit about your personal experiences with insomnia? I know you've shared your experiences with being prescribed sleep aids. So I'd love to just hear more about what your experiences were with that and what helped you
Yeah.
get off. Because I know a lot of patients when they're or even doctors, when they're prescribing patients sleep aids, there isn't really a plan to get off of them. And sometimes there can just be this idea that, okay, well, this is what helps you, so we're just going to stay on that forever. So just love to hear your thoughts on that.
Yeah. Well, I started taking the sleeping pills probably 20 years ago. I was going through sort of a personal crisis and was given the pills by my doctor. It was Ambien, actually. And during that time of my life, I was a pharmaceutical sales rep. So in my world, medications were very much acceptable. Um, I didn't think twice, because I'm like, every day I'm talking about medications, I'm giving samples to doctors and whatnot. So, I willingly took the sleeping pills because I was just so desperate. I was just like so miserable because I had sleep onset insomnia and I could not. It took me like up to 2 hours many nights to fall asleep. And then I had to get up for work and I was just like very, very miserable. So the pills actually did help me get to sleep a little bit faster. They did work as advertised, but I had a lot of side effects. Occasionally I would have like food binging episodes after I'd taken the pill. I'd like find, that I'd eaten a whole box of cookies or just random things like that. But I think the biggest issue for me was the morning grogginess and brain fog that I had. And unfortunately, that did not subside until like close to lunchtime. And it actually had negative effects on my job. So I went from pharmaceutical sales to another type of work, where in healthcare, at a state health department, doing communications and PR. And I was responsible for writing all of this content and press releases. And they expected me to write really quickly. And there were many days where they were like, okay, here's an assignment. And I was just like stuck at my keyboard, like, like a deer in the headlights, because I had such brain fog from the pills. And that affected my work performance. But after, all of this happened, I learned that I was actually being overdosed on Ambien, because in 2013, they changed the prescribing directions for women. They basically figured out that women were getting too high of a dose. So they asked the manufacturers to alter the dose for women. So I was essentially getting overdosed. And I think back on it and I'm like, I was driving downtown to work every day, probably impaired many days, and, to be truthful, sometimes I had alcohol with the pills on the weekends or whatnot. I mean, that's kind of throwing gas to the fire, right? Um, so what ended up happening was, about 8 years into this pill dependency, I met a man who was my new boyfriend at the time. He's now my husband. And he said to me in a very kind, loving way in the very beginning, when you take those pills, you kind of act like a zombie and it freaks me out. And I thought, oh my gosh, he's right. This is like, it was a huge wake up call. And so what I decided to do was just use a pill cutter and just cut the pills, into halves and fourths. And I just tapered myself off. But it wasn't easy. I had a lot of stops and starts with it, but just because I was very determined to do it, I managed to do it, and it went fine. But it's hard. Like, I have a lot of clients who have gone through what I've gone through and have had stops and starts and no support. It's very hard when you feel like you need something like that to get a good night of sleep.
Absolutely. Thank you for sharing that. Yeah. And I think that's a really relatable story where, the medications, they kind of help at the beginning and you're like, okay, well, at least I can get some sleep. But then there's all these other insidious after effects, like you were talking about the brain fog and stuff. I see that a lot with patients in my practice where they might not attribute their daytime fatigue and grogginess to a medication. They might think, oh, I'm not getting enough sleep, so maybe I need more sleeping pills
Yes,
to feel
exactly.
more awake. Yeah. What was your experience with tapering off? What advice might you give to, let's say, the doctor, who's listening to this? How can they best support their patients in the tapering process, just from your own personal experiences and
Yeah.
your work as a sleep coach?
Yeah. Well, I would say go very slowly. Um, but I think where the doctors might not be able to do this because of the structure of their role is the support. Like, I'm meeting with these folks, weekly, every other week. They have access to me through my portal. They can talk to me anytime. It's not like a chat where I'm like constantly in there, but like if they send me a message within a few hours, usually I'm answering them and helping them and supporting them. So I feel like I just feel like it's kind of difficult for a physician, unless they're in a very unusual kind of practice, to be able to be that hands-on with their patient. But I think, in general, the slower the better, to taper. And I feel like you might be in the same, based on our conversations, and the same mindset. Um, Slower the better.
Yeah, absolutely. I totally agree with that. And yeah, and that's something, we talk about in our clinical sleep kit program, which is, yeah, I mean, it really is about, I like to go as slowly as possible, so that the patient doesn't feel completely destabilized. And then, of course, like you said, making sure they have all the behavioral supports in place as they work through the taper. And a lot of it is mindset work too, around um, the sleeping pill and, beliefs they have about their sleep. And so there's lots of different layers to it. So maybe I think that's a good segue into you sharing maybe a bit more about your approach, because I know you blend CBTI, which is cognitive behavioral therapy for insomnia, with mindfulness practices. You also have a health coaching, nutrition background. So could you share more
Yeah,
about how you work with your clients and
sure.
what your approach is? It's not just a
Yeah.
pure CBTI approach.
Yeah, exactly. So I really call myself a holistic sleep coach because I'm looking at so many different aspects of my client's life. So I take a deep delve into their health history. So I want to know really in depth what their health status is like. Have they had, are they dealing with other health issues on top of sleep? Is that's important to know. I like to kind of track what they're eating, track their movement. And that's not, most of my clients for some reason are like women who are very health conscious, and they're very like healthy eaters, and they don't need the monitoring of their, food. But I think it's helpful to kind of get a sense of like what time they're eating, what foods they're eating, their movement, finding out their chronotype, finding out really what kinds of attitudes and beliefs they have about sleep by using, a test online that you can give a client. And then I really kind of take a look and see if they would be a good candidate for CBTI. And a lot of people are, a lot of people though aren't. And they really have to be all in to do it. They have to be all in. And what I have found in my experience working with a couple of clients who found me after experiences with a very strict CBTI protocol is they were just like that, the protocol they were put on created a lot more anxiety. Like, for example, I worked with a young woman who had insomnia. She went to a therapist. The therapist was very by the book, sleep restricted her for like maybe 5 hours of sleep. So she was like going to bed at 1 o'clock, having to get up and go drive her child to daycare. She was crying in the car. I mean, it was creating a lot more anxiety for her. So when I worked with her, we did a lot more of a gentle approach. We did some, sleep compression, but it was just a lot more meeting her where she was, because not everyone is going to be willing to do some of them, they're not going to be willing to do the stimulus control and get out of bed all the time, or they might not be willing to sleep restrict as much. So I feel like in some trainings of CBTI, it's very rigid and sometimes it's very clinical. And I think that when you actually get in front of a real client or patient, things come up that are like outside of like what you were taught. You have to kind of just sort of augment the protocol so that the client will be amenable to following it. So that's
Yeah.
kind of that's really my approach. And then the mindfulness aspect is really good as well, because that really helps primarily the client feel more comfortable with the discomfort, or embrace the discomfort of sleeplessness, of the next day consequences of not sleeping, and helps them be more in the moment and not catastrophize. I think that's a really important thing to help people understand, is the catastrophe, helping them gain confidence, helping them understand that going through with their plans for their life, like actually, showing up for work, showing up for social events, not limiting their life for the sake of the insomnia, because that ends up feeding the sleep anxiety more and more and more. So it's kind of getting them out of their comfort zone in baby steps. It's almost like kind of exposure therapy in a way, I think.
Yeah, absolutely. And I love how you sort of put that, which is that, CBTI works, it's effective, but it needs to be personalized to the patient. And if you're just following these rigid protocols, it might not actually be serving the patient or the client that's in front of
Yeah.
you.
And another thing that I've been working on a lot recently, something that I've been very interested in, is circadian biology.
Mhm.
So helping clients design a protocol that really uses light, especially in the morning. There's a really awesome app called the Circadian app. And I've started having my clients download that app so that they can see the times. So it's geo specific to where they live, seeing the times of day when the sun sets and rises, when UVA light hits, when UVB hits, so that they can kind of get the exposure to all the different light spectrums that help with mood and focus. Because I think that I'm really seeing a lot of results. And that's just really interesting to me, because it's a free thing and anyone can do it. I mean, we all have access to it. So I think that's been another interesting layer that I've added on over the past few months, just from my own, just trying it for myself, and realizing, wow, this is really effective. And then just sharing those tools with them. It's been
That's great.
nice.
Such a great resource. Yeah, the
Yeah.
circadian app. Yeah, and again, like, and this is kind of like the new wave in behavioral sleep medicine, right? Like, before it used to be, the CBTI, which is still the gold standard, but now even big names in sleep medicine like Colin Espy and people like this are talking about this new wave of behavioral sleep medicine that includes CBTI along with circadian regulation, a big focus on that, with mindfulness or acceptance and acceptance and commitment therapy, modalities, and blending all of these things. And even in my practice, I'm seeing better outcomes with that sort of approach than the pure CBTI.
Yeah. That's great to hear. We're having the same experience with this. That's awesome.
So if people want to work with you, if they want to refer patients to you or clients, how can they find out more?
Yeah, my website is morganadamswellness.com. I have a um, complimentary consultation that I offer. I have a free mini course that helps people sort of set their morning and evening routine. If they're sort of naive to routines, I feel like it's a good anchor. Those morning and evenings are great anchors to get a routine together. And I also have a course for midlife women who have insomnia called Midlife Sleep School. So some different options for, where you are in the process.
Great. So I'll put all of those resources in the video description below. So everyone go ahead and check out Morgan's website and her free course and her other offerings for women. So if you have patients or clients who are women who need more support with their sleep, you can send them to Morgan, because Morgan, you're able to work with people virtually basically across the US, or are you limited to geography?
I am wide open internationally. As long as we can make the times work, we're good.
Fantastic. Yeah.
Yeah.
So this will be a great resource for people who are looking, for a place to refer your patients for behavioral sleep medicine. Maria, thank you so much. Is there anything else that you'd like to share? Maybe a sleep tip to leave our clinicians with for today?
Well, I would just say that if you are talking to your clients or your patients, and you can only say one thing for them to do, I would suggest having them get outside and get that morning light exposure within an hour of waking without anything on their eyes, because you need the naked eyes. And it really does make a world of difference. I've heard dozens of people, not just my clients, but just when I'm sharing this tip on social media, people will write me back, this really works. So that would be the one tip that I would leave somebody, because anyone can do it.
Great. Yeah, that's a fantastic tip. So thank you again for sharing your expertise and your time with me today. I'm really grateful for you being here.
Thanks, Nishi.